let's go ahead and introduce yourself and tell us a little bit about your story. We were talking about how you got into healthcare and how you
Mhm.
eventually progressed into being a nurse practitioner. So tell us your story.
Sure. So I started off as a medical assistant way back in 2004, and I really enjoyed doing what I did there as a medical assistant. I did that for maybe about approximately 3 years, and during that time frame, I went back to school to gain my licensed practical nursing degree and certificate. And during that time, also, I stuck with clinical practice. So I was in family practice, hematology, oncology, bariatrics. So I did it all during that time. Then I learned a little bit more about midwifery. And I wanted at the time, before I learned about midwifery, I wanted to become an OBGYN because I just absolutely loved medicine and I wanted to help women and deliver babies. And I was all gun ho about it. So then I learned about this midwifery. And so I said, well, okay, I could still become a nurse and stay a nurse and, not have to worry about all the doctor things. So then I went back to school, of course, and did my registered nursing degree. And so I took the LP and the BSN route at OU, which is the University of Oklahoma here. Did that for 9 months. It took me 9 months to get that particular degree. Worked for a year as a med surg nurse, just so that I can gain the experience that I needed. And then went to labor and delivery and thought, yeah, I get to be a labor nurse and I'm going to deliver all these babies and do all these things. So, but that didn't happen. I actually decided to stick with postpartum care because I love the education piece of it. I am one that I am a self starter, so I go and I read books and I educate myself. So I love to educate people of those same things. So I decided not to labor train at all and really turn my direction towards postpartum care and teaching patients how to care for themselves as well as their babies and empower them to be a self advocate whenever it came to not knowing what to do next. And so that, of course, turned into me going into school. Instead of doing the midwifery route, I decided to do women's health. So I did my master's degree and my doctoral degree, so doctor in nursing practice at Frontier Nursing University in Kentucky. So here I am.
Here you are.
All
And
of
tell us
that.
a little, yeah. So tell us a little bit about your practice, Holistic Well Women's
Mhm.
DPC. We're
Okay.
very familiar with DPC, but tell us about what makes you unique.
Mhm. So, what makes me very unique is that I am a direct primary care practice for women's health. So, when you hear direct primary care, you think family physician or family practice. But I actually am a gynecological background. So, my goal with this entire practice is to help the woman be empowered for her care. So I want to be a partner in her care versus a dictator. And so what I found in the 5 years of practice that I've already done within the traditional healthcare facilities, such as the hospital-based facility I worked in, as well as the federal qualified facility, is that I could not really hear my patient and give them the care that they actually needed and that they desired. Instead, it was just get them in, get them out, and symptom treat. And I didn't want to do that anymore. So I stepped away from that and created my entire practice based on just letting women know that they are empowered and that I hear them and they are welcomed here 1 hour versus having to sit in the lobby for an hour or the room for an hour. You have me personally for an hour. You have direct access to me even after hours through a messaging app called Spruce, and it's HIPAA compliant. So if they need me, I'm there. So it changes a lot of the way I practice and the way that my patients are being treated. They actually feel like a person instead of a number.